Oropharyngeal suctioning is a procedure used to remove secretions from the oral cavity and pharynx. Secretions can block the trachea and obstruct the normal airflow, which can lead to an insufficient oxygen supply. Normally, clients cough to remove these secretions, but some individuals are too weak or cannot cough, so these clients require suctioning to clear the airway. Generally, the nursing assistant should alert the nurse if they think a client requires suctioning. They can assist in oropharyngeal suctioning by gathering the required supplies, and in some cases, the task can be delegated to a nursing assistant with expanded scope. Before you proceed with assisting with the procedure, make sure it's within your scope of practice and is permitted by your facility policy. Now, common signs and symptoms that suggest a client may require suctioning include difficulty coughing up secretions and swallowing, decreased consciousness, visible secretions that obstruct the airflow, vomitus in the mouth, and noisy breath sounds. This procedure is also used in individuals who have had oral surgeries, mouth trauma, or cerebrovascular injuries, like a stroke that results in drooling and impaired swallowing. Finally, oropharyngeal suctioning is used to provide oral hygiene and prevent infection in individuals that have impaired swallowing or artificial airway. Now, the suction catheter used for oropharyngeal suctioning is a rigid, bent, and plastic catheter called the Yankhauer suction catheter, or Yankhauer tip. A Yankhauer suction catheter is transparent, which lets you see the secretions and fluids being suctioned out. The standard type of Yankhauer catheter has a bulb tip with one large and several smaller openings. The bulb tip prevents trauma to the oral cavity, while smaller openings provide suctioning even if the large opening is blocked. Switching gears and moving on to the supplies you need to gather for the procedure. This includes clean gloves, mask and goggles or face shield, bath towels, cloth or disposable paper drape, disposable cup or wash basin, and tap water or normal saline. Most importantly, you need the suction device and connecting tubing. If indicated, you should also get an oral airway and washcloth. For the procedure, the client should be in a semi-Fowler or sitting position with a bath towel, cloth, or paper drape over their chest. Perform hand hygiene and apply clean gloves. Use a face shield or mask and goggles because suctioning can cause splashing. Next, fill the cup or wash basin with water or normal saline. The nurse will insert the catheter and run it along the gum line to the pharynx where the secretions are suctioned out. The catheter should be rinsed by placing it in the cup or wash basin because this prevents the catheter and connecting tubing from becoming clogged with secretions. Once done, remove the bath towel, cloth, or disposable drape, reposition your client, and clean up supplies. Finally, remove the gloves, face shield, or mask, and don't forget to perform hand hygiene. Now, switching gears and moving on to reporting. If you're assisting in the procedure, be sure to bring any abnormal observation to the nurse's attention during the procedure and document them afterwards. Alright, as a quick recap, oropharyngeal suctioning is a procedure used to remove secretions from the oral cavity and pharynx. Check with your scope of practice and facility policy before assisting in the procedure. The suction catheter used for this procedure is called the Yankhauer catheter. Supplies for this procedure include clean gloves, mask and goggles or face shield, bath towels, cloth or disposable paper drape, disposable cup or wash basin, tap water or normal saline, and a washcloth. Most importantly, don't forget a suction device, connecting tubing, and suction catheters. After the procedure, report and document any abnormal observations.